Hi, I'm Karen Collins. I'm here today with Lynette Kraft, who is Assistant Professor of Preventive Medicine at the Feinberg School of Medicine at Northwestern University, where she specializes in looking at the relationship between exercise and depression, how it might play a role in mood changes and be a part of treatment for depression. So thanks very much for taking this time today.
Sure, thanks for having me.
Lynette was presenting at the SCAN conference, and you were really talking first in part of how exercise might play a role in treatment of depression, right?
That's right. So we have a lot of research to suggest that for individuals who have been diagnosed with clinical depression, that exercise can be a very effective antidepressant. And we have a few studies even that show that for folks who are already on antidepressant medication and aren't having a complete treatment response, exercise may give them that little extra boost they need to really regulate their mood.
That's great. And sometimes might they then say need a lower dose of medication than they would other need? Have you otherwise need?
Yeah, you know, there haven't really been any studies looking at kind of tapering medication as exercise increases, but certainly we know that there are folks, just from our own research studies, that do find that they're able to take less medication as they are regularly exercising. We don't really recommend that as someone starts an exercise program and they're doing it infrequently to mess with changing their medication too much, but once it becomes a regular routine and part of the lifestyle, oftentimes it is helpful to talk with your physician about maybe lowering your medication.
Yeah, you were very clear that this is not a change somebody makes on their own.
That's
this
right.
is something they discuss with their physician. Now today you were talking about the different theories behind this. There are potentially physiologic as well as psychological reasons for this benefit that you see?
That's right, and we don't have a lot of research in this area, but what we think might be happening is that exercise may be changing some of the chemicals in the brain that help regulate mood, as well as some of the other symptoms that we see with depression. So things like appetite, sleep, the desire, need to engage socially. So things like serotonin, norepinephrine. It looks like our exercise changed with exercise, so that one way exercise may be helping with symptoms of depression is to, balance out some of those chemicals in the brain that are altered in depressed folks. So that's one thing we think might be happening. We also think that exercise may be stimulating some growth in the brain of new neurons. We know that folks with depression oftentimes have less dense neurons. They have just different brain physiology sometimes if they've had depression for a long time. And it looks like exercise maybe will help promote growth factors that help folks with depression grow new neurons, which then helps regulate these neurotransmitters and chemicals in the brain. Most of that work has been done with animals. We don't have good human data at this point, but it's a potential idea. And there are also some psychological mechanisms that might be at play. So for example, we talked about self-efficacy today as being very important. Oftentimes when you learn a new health behavior and you learn to apply that to manage your symptoms, you kind of have a sense of empowerment and a higher confidence to manage your symptoms. And so one way that exercise may help is to help people enhance their feelings of confidence around managing their depressive symptoms. So that's one thought. And then it may just really help mood in the short term. So folks may be able to get a brief boost of mood enhancement following exercise, which then alleviates some of the distress that they're feeling from their depression, and it may help in that way.
Now, one of the things, and I'm not sure if I even caught this quite right, but you were comparing in the mood affect piece, exercise versus a brief rest, because a rest sometimes helps to alleviate pressure when you feel badly too, but there was some interesting contrast there.
It was interesting. So there's one study that looked at comparing a 30-minute bout of exercise to quiet rest in a pleasant environment. And oftentimes we do feel like when we're stressed or feeling pressure that if we can just sit down and be quiet for a few minutes that we'll feel better. And the interesting part of this research was that the researchers looked at negative aspects of mood, things like confusion, fatigue, depression, as well as positive aspects of mood, things like vigor or feeling invigorated or just a sense of well-being. And they actually found that exercise and a quiet rest were quite similar with respect to reducing these negative aspects of mood, but exercise was superior in enhancing the positive. So with exercise you not only get a reduction in the negative, but you may get a boost in those positive feelings of mood as well. So that's a really interesting finding that may be applicable to folks who have depression. So while the the urge may be to just go sit and rest and be quiet, perhaps exercise will do even a little bit more for you. As well as the numerous other physical health benefits that come from being regularly active.
Absolutely.